Welcome to Divine Inspired Care channel. Thank you for joining us again. Today we will learn about the different types of colostomy procedure. Let's get into it. Have you ever wondered what happens to your food after you swallow it? Or what life would be like if your body had to bypass a part of its normal digestive process? Today, we're going to explore these questions as we journey through the intricate labyrinth that is the human digestive system and examine a unique medical procedure known as a colostomy. This knowledge is not just crucial for healthcare professionals, but for patients as well. So get ready to dive into the fascinating world of your digestive system and learn about a unique medical procedure known as a colostomy. The journey of your food starts right in your mouth. The first stage of digestion actually begins before you even swallow. When you take a bite, your teeth break the food down into smaller pieces through a process known as mastication, or more commonly, chewing. As you chew, your salivary glands spring into action, secreting saliva to moisten the food. It contains an enzyme called amylase that begins the chemical breakdown of carbohydrates in your food. The result of this mastication and salivation is a soft rounded mass called a bolus. Once the bolus is formed, it's time for it to take a trip down the esophagus, a muscular tube that connects your mouth to your stomach. This is accomplished through a series of muscular contractions known as peristalsis. So, the first stage of digestion is complete, and the bolus is now ready to enter the stomach. From here, the bolus embarks on a remarkable journey through your digestive tract. After being swallowed, the bolus moves down the esophagus, aided by wave-like muscle contractions known as peristalsis. These gentle ripples guide the bolus into the stomach. The stomach, a muscular bag-like organ, welcomes the bolus with a bath of gastric acid. It's a chemical powerhouse designed to break down the bolus into a semi-liquid substance called chyme. Think of it like nature's food processor, turning chunks of food into a smoothie of sorts, ready for the next stage of digestion. Once our chyme smoothie is ready, it's ushered into the small intestine. There's nothing small about the role of the small intestine in digestion. This is where the magic really happens. The small intestine, divided into three sections, the duodenum, jejunum, and ileum, is where the majority of digestion and nutrient absorption takes place. Each section of the small intestine has its own unique role. The duodenum breaks down the chyme further with the help of enzymes and hormones. The jejunum is the superstar of nutrient absorption, taking in proteins and sugars. The ileum absorbs the remaining nutrients, including vitamin B12 and bile salts. After the small intestine has had its fill, the remaining chyme, now stripped of most nutrients, passes into the large intestine or colon. The colon's primary role is to absorb water and electrolytes from the remaining chyme, transforming it from a liquid state into a more solid form that we recognize as stool. The large intestine is also home to trillions of bacteria, collectively known as the gut microbiota. These friendly microbes help break down remaining undigested food, aid in the production of certain vitamins, and play a crucial role in our overall gut health. Now that the nutrients have been absorbed, the remaining waste is ready to exit the body. And with that, we conclude our journey through the digestive tract. But what if I told you that for some people, the journey doesn't end in the large intestine? For these individuals, a medical procedure known as a colostomy comes into play. A colostomy is a surgical operation that changes the route of the digestive journey. It's like a detour sign in the middle of the digestive highway. The surgeon creates an opening in the colon, bringing a portion of it to the surface of the abdomen. This new opening, called a stoma, serves as an alternative exit for the body's waste. Now you might be wondering, why would someone need a detour in their digestive journey? Well, certain medical conditions or injuries can make it difficult or impossible for stool to pass through the colon and out of the rectum in the usual way. In such cases, a colostomy offers an alternate route, allowing the body to rid itself of waste efficiently. The process of creating a stoma is quite fascinating. The surgeon selects a suitable spot on the abdomen, makes an incision, and brings a part of the colon through this opening. The exposed end of the colon is then turned down and stitched onto the skin, creating the stoma. It might sound a little overwhelming, but remember, this is a carefully crafted procedure performed by skilled surgeons. So what happens after the stoma is created? Stool is diverted from its usual path and exits the body through the stoma instead of passing through the rectum. This waste is collected in a specially designed pouch that adheres to the skin around the stoma. It's a different way of doing things, certainly, but it allows people to continue their lives without being held back by digestive difficulties. A colostomy may sound intimidating, but it's a life-saving procedure that allows people to continue living fulfilling lives. It's a testament to the wonders of medical science, providing a solution when the natural course of digestion is disrupted. There are different types of colostomies, each named for its location in the colon. Just as each person is unique, so too can be the type and placement of a colostomy. Let's start with the descending colostomy, which is located in the left upper abdomen. Then there's the ascending colostomy, positioned on the right side of the abdomen. The transverse colostomy is found in the mid-abdominal region, while the sigmoid colostomy is positioned in the lower abdomen. Each of these types corresponds to the section of the colon that has been brought to the surface to create the stoma. There's also a variation called a double-barrel colostomy, where two stomas are created. In this case, one serves as an outlet for stool and the other for mucus. Now let's talk about the care that comes before and after the colostomy surgery. Preoperative education is crucial. Patients learn about the procedure, what to expect, and how they will need to care for their stoma and manage their diet afterwards. Empowering them with this knowledge can help ease anxiety and prepare them for the changes ahead. Post-operatively, the care team monitors for complications such as infection, dehydration, and stoma viability. Nurses play a vital role here, educating patients on how to manage their colostomy pouching system. This pouch collects stool that exits through the stoma and requires regular maintenance. The goal of this care is to enable patients to manage their own colostomy, promoting independence and improving quality of life. With the right care, a colostomy doesn't have to limit a person's activities or lifestyle. This brings us to an important point. A colostomy is not the end, it's a new beginning. It's a chance to lead a fulfilling life, albeit with some adjustments. So, remember, with proper care and management, a person with a colostomy can lead a normal and productive life. Managing a colostomy extends beyond surgery and involves dietary changes and medication adjustments. Let's delve into these aspects. When it comes to diet, adjustments are often necessary to prevent blockages or excess gas production. Certain foods can pose challenges to individuals with a colostomy. For instance, nuts and seeds, while nutritious, can lead to blockages due to their hard-to-digest nature. Similarly, high-fiber foods like whole grains, legumes, and certain types of fruits and vegetables can cause excessive gas. But it's not all about elimination, it's also about inclusion. Including easy-to-digest foods like rice, bananas, and lean proteins can help ensure smooth digestion and prevent complications. It's always a good idea to experiment with different foods and observe how your body reacts, under the guidance of a healthcare professional, of course. Now let's talk about medications. Those with a colostomy need to be mindful of the types of medications they take. Time-released or coated medications, for example, may not be suitable as they may not be absorbed properly. It's vital to discuss with your healthcare provider about any medications you're taking or plan to take to ensure they're safe and effective. Remember, everyone's body responds differently to diet and medications, so what works for one person may not work for another. It's a process of trial and error, and it requires patience and persistence. Balancing diet and medications is crucial to maintaining good health with a colostomy. Understanding the digestive process and colostomies is not only fascinating, but also essential for those living with a colostomy. We've journeyed from the mouth, where the first steps of digestion take place, through the intricate network of the digestive tract to the final destination, the colon. We've explored the complex and careful procedure of creating a colostomy and the various types that can be formed, each with its unique position and function. Our journey didn't stop there, as we delved into the necessary pre- and post-operative care and the importance of managing diet and medications to ensure a healthy and comfortable life post-colostomy. All these elements come together to paint a comprehensive picture of the digestive process and the world of colostomies. With comprehensive management of diet, medications, and stoma care, individuals with colostomies can lead fulfilling lives while maintaining their digestive health. Thank you for joining us on this enlightening journey through the digestive system and the world of colostomies. If you found this video helpful, we encourage you to share it with others who might also benefit. Knowledge is the first step towards understanding and empathy. And remember, subscribing to our channel ensures you won't miss out on future videos packed with important information. In the world of health and medicine, knowledge truly is power. So stay informed, stay healthy, and join us again for another journey into the fascinating world of the human body. Until next time, subscribers, goodbye.